You know that moment when a health headline pops up, maybe about, I don't know, a new diet or some viral outbreak, and you think, huh, I should probably understand that.
Oh, absolutely. Happens all the time.
Well, in today's world, being able to sort of decode all that information isn't just nice. It feels pretty essential for, navigating our lives.
It really is. We're constantly faced with health and medical news, right? And our ability to make sense of it directly impacts the choices we make for ourselves, for our families.
And that's exactly what we're digging into today, something called biomedical science literacy. Now, okay, in practical terms, what does that actually mean for you listening?
Mm-hmm.
Well, from what we've gathered from our sources, it's basically about having the ability to find, understand, analyze, and then, crucially, use that information to make smart choices about your health and medical care.
Right. And it's not about needing a PhD in biology or anything.
No.
It's more about having those fundamental skills to engage with health-related information meaningfully, just as you go about your day.
We've got a really interesting stack of materials here today, including a pretty detailed report that lays out an action plan for boosting this kind of literacy across the U.S.
Yeah, some really good stuff in there.
So our mission for this deep dive is pretty straightforward. We want to pull out the key insights, the real knowledge nuggets, so you get a clear picture of where things stand on this really important topic, without feeling like you're drowning in jargon.
And my role here is to help kind of weave these different threads together, see the connections, and maybe give a broader sense of why this all matters in the real world.
Okay, so biomedical science literacy. It sounds a bit like just knowing science generally, or maybe just health literacy.
Right.
What makes it distinct?
That's a really good question because they are related. But biomedical science literacy has a very specific focus. It's about understanding and applying scientific thinking specifically within a medical context.
Okay, medical.
Yeah. So think about grappling with those often controversial scientific issues that pop up in the news or in daily life. Things like vaccines or maybe new gene therapies.
Things people are talking about.
Exactly. It's about having a functional understanding of the science involved in these health and medical areas, not necessarily being an expert researcher yourself.
So it's science applied to health decisions. Makes sense.
Precisely. Now, health literacy is also super relevant here. The National Assessment of Adult Literacy, BAL, they defined it as your ability to use printed and written health info to function in society, basically. To achieve your goals, build your knowledge about health.
So very practical, focused on written stuff.
Very practical, yes. And NAL actually broke that down further, didn't they?
Yeah, they did. Into different ways we interact with written information.
Right. They talked about prose literacy, like understanding text in a brochure or a leaflet.
Okay.
Document literacy, that's using things like forms or maybe reading a food label. Non-continuous text.
Right, like filling out medical history.
Exactly. And then quantitative literacy, that's dealing with numbers embedded in text. So figuring out a medication dose from the instructions, that kind of thing.
I can picture those. Reading about a condition, that's prose. Filling out forms, document, calculating dosages, quantitative. Got it.
Perfect. And, more recently, the Healthy People 2030 initiative has kind of built on this. They distinguish between personal health literacy.
Which is the individual's ability.
Yes, your ability to find, understand, and use health information. But they also added organizational health literacy.
So how well the organizations, hospitals, clinics enable people to do that.
Exactly. Which feels like a really important shift, doesn't it? It recognizes it's not all on the individual to navigate these often complex systems.
Yeah, that's a huge point. It acknowledges the system's role.
Absolutely. It highlights that literacy isn't just your skills, but also how accessible and, frankly, understandable the information and services are that you encounter. But the key thread, running through all these definitions, biomedical science, literacy, health literacy, is that emphasis on function, on using the knowledge.
Right, not just knowing it, but doing something with it.
Precisely. Being able to actively apply it in real-life decision-making, especially when the information itself can be so complex.
Okay. So with that framework in mind, what's the current situation? What do the surveys, the research tell us about where the U.S. actually stands right now? What's the big picture?
Well, the findings paint a bit of a mixed picture, honestly. If you look at data from the Pew Research Center back in 2019, it showed that many Americans can answer some basic science questions correctly.
Like what?
Well, for instance, a good number understood concepts like antibiotic resistance or what an incubation period is, things with pretty direct health relevance.
Okay, that sounds moderately encouraging.
And it is. It's a positive start. But understanding other fundamental ideas, like identifying a scientific hypothesis, that was less common. Their science knowledge quiz, I think it had 11 questions. The average score was about 6.7 correct. And roughly, 39% of Americans scored relatively high?
So a majority didn't score high.
Right. Which might suggest that, concepts with really tangible consequences, like antibiotic resistance affecting your health, maybe those are easier to grasp than the more abstract process of science.
That makes sense. So definitely room for improvement there. What about other data, like from the National Science Foundation?
Yeah, the NSF data. Around 2014, it showed U.S. adults correctly answered, on average, about 65% of factual science knowledge questions. And interestingly, that average has been pretty stable for a couple of decades.
Okay, so consistent but not stellar, maybe. How do we compare internationally?
We tend to rank somewhere in the middle compared to other developed nations on that factual knowledge front.
Right, not leading but not, at the bottom either.
Exactly. But then you look at understanding how science actually works.
The process part again.
Yes. And that's where we see some more notable gaps. The 2020 NSF data, for example, found that while about 2/3 of U.S. adults agree, science involves testing ideas and revising findings.
Which sound good.
It does, but only about 60% could correctly identify the purpose of a control group in an experiment, and just half could correctly pick out a scientific hypothesis.
Wow. Okay. That feels like a really fundamental disconnect. If you don't get the process, how can you evaluate the claims you hear?
That's precisely the issue. Now, shifting slightly, what about public confidence in science and scientists?
Yeah, what does that look like?
Generally, it's pretty favorable, actually. For many years, Americans have mostly supported science and tech, generally agreeing the benefits outweigh the harms.
Okay.
And in 2022, a strong majority agreed that federally funded basic research is necessary, even if there aren't immediate payoffs.
That's good to hear.
And confidence in scientists specifically to act in the public's best interest. It remains relatively high compared to many other professions.
That's reassuring, especially now when trust in institutions can be shaky.
It is. Though there was an interesting dynamic during COVID. We saw confidence in scientists tick up quite a bit in 2020.
Right, at the peak.
But that level has since come back down, more or less to where it was around 2016 by late 2022.
Interesting fluctuation.
It is. But even with that decline, a majority of people actually reported feeling a greater appreciation for science because of the pandemic.
It was certainly front and center, wasn't it? Scientific concepts were everywhere.
Absolutely. The pandemic was essentially this involuntary, intense crash course for the public in things like immunology, virology, epidemiology.
Yeah, suddenly everyone is talking about R-naught values.
Exactly. But while it might have boosted familiarity with certain terms, it also really threw those pre-existing literacy gaps into sharp relief. And it highlighted the real challenge people face trying to navigate information that was changing rapidly, sometimes seemed conflicting.
So we might have learned some new vocabulary, maybe. But our underlying ability to really grasp and evaluate the science didn't necessarily keep pace.
I think that's a very fair assessment. And that leads us right into some of the key knowledge gaps that the sources pinpoint.
Okay.
We've touched on understanding the scientific method, but it's worth stressing again. People might define elements, like a hypothesis, but applying that understanding to judge a claim or interpret research, that seems to be the real hurdle.
Right. Those NSF numbers, again, half identifying a hypothesis, 60% getting control groups.
Exactly. It really underscores the difficulty. It's like knowing the names of tools, but not knowing how to use them to build something.
Good analogy. What other major gaps did the sources highlight?
Another really critical one is interpreting data and statistical information.
Oh, yeah, the numbers.
Big time. Concepts like risk, probability, that crucial difference between correlation and causation. These can be really tricky for a lot of people. The National Institutes of Health, the NIH, they really emphasize how vital it is to understand the numbers behind the messages in health info.
And that connects right back to that quantitative literacy thing, right? Like medication doses.
Directly. And it has immediate real-world impact. There was a concerning finding from a 2019 study. Only about 59% of people could correctly answer a question based on a simple chart.
Wow, less than 60%.
Yeah. And think about how many charts and graphs we were all bombarded with during the pandemic. If you haven't developed those skills, it's easy to just feel lost or worse, misinterpret things.
It's like trying to read a map without knowing what the symbols mean. You see the lines, but...
Precisely. Another big issue is a common misconception. thinking of science as just a big pile of memorized facts.
Right, instead of a process.
Exactly. It's so much more dynamic. It's investigation, trial and error, collaboration, and the way media sometimes portrays science. Highlighting conflicting studies without much context.
The coffee is good for you, bad for you headlines.
That's the classic example. It can really sow confusion and erode trust if people don't grasp the iterative nature of research, how knowledge builds, or the idea of a hierarchy of evidence.
You mean like how some study designs are stronger than others?
Exactly. Like large randomized controlled trials usually carry more weight than, say, anecdotal reports or small observational studies. Without that context, it just looks like scientists can't make up their minds.
That makes so much sense. It feels less like flip-flopping, if you understand it's about refining knowledge over time.
Precisely. And one last point here. The sources also mention the difficulty many people have just reading and analyzing actual scientific papers.
Oh, for sure. Even for students.
Yes. Even in higher education, the dense language, the jargon, it's a real barrier. It really highlights that we need to teach not just the what of science, but the how to decode scientific communication itself.
It's like learning a whole new language and culture almost to read those primary sources.
It really is.
Okay. And critically, this biomedical science literacy, it's not spread evenly across the population, is it? The sources point to some significant demographic differences.
No, it's definitely not evenly distributed. Education level is a major factor. Pew Research found a really stark difference in science knowledge scores between people with postgraduate degrees and those with high school education or less.
Much higher scores with more education.
Significantly higher. The percentage classified as having high science knowledge was much greater for those with more schooling. And this pattern holds for confidence in scientists, according to NSF data, and also understanding the scientific method.
That makes intuitive sense, I suppose. More education often means more exposure.
It often does, but the differences don't stop there. We also see notable disparities linked to race and ethnicity.
How so?
Well, Pew Research has consistently found that white adults tend to score higher on these science knowledge tests compared to Hispanic or Black adults. The national academies have reported similar patterns. And these literacy gaps, unfortunately, often mirror other disparities, like underrepresentation in the biomedical workforce itself, and even gaps in NIH research funding for Black researchers.
Wow. That's a really concerning connection. It suggests deeper systemic issues are at play.
It certainly points that way. And income level also correlates. NSF data from 2022 showed a link between higher income and greater confidence in scientists, and the national academies found a strong relationship between factual science knowledge and income, too.
So it looks like a complex mix of education, race, ethnicity, income, all playing a role.
Absolutely. And adding another layer, a 2023 study introduced this really interesting concept of biomedical mindsets.
Mindsets, what does that mean?
It means that demographic groups aren't monolithic, right? People within those groups have different views. This study identified distinct segments within the general Black and Hispanic populations based on their trust in science, their interest, perceived barriers.
Fascinating. Can you give an example?
Sure. They found a group they called Society Needs Science. High trust, very engaged. This was the largest segment overall and among Hispanic respondents, but a smaller proportion among Black respondents.
Okay.
Then there was a segment called I Can't Be Bothered. Low engagement, kind of detached. This segment was unique to and the largest within the Black population sample. And crucially, this group also reported the highest likelihood of avoiding medical treatment due to fear of racial discrimination.
Wow. That really highlights how lived experiences, like discrimination, can shape attitudes towards science and medicine. It's not just about the information itself.
Not at all. It's deeply connected to trust and historical context. They also found a gut thinkers segment, more skeptical of experts, less interested in scientific reasoning, disproportionately lower income and education.
So different groups have different orientations towards science, shaped by trust, experience, information sources.
Exactly. And the study really emphasized that trying to address disparities requires understanding these underlying mindsets and tailoring approaches. You can't just use a one-size-fits-all information campaign.
That makes complete sense. You have to meet people where they are and adjust their specific concerns or reasons for skepticism.
Precisely. And the implications of all these disparities for health equity are just profound. Lower literacy often links to poorer health outcomes, less preventative care, more difficulty navigating the healthcare system, particularly for already marginalized communities.
It really underscores why boosting this literacy across the board is so incredibly important for a healthier, more equitable society.
Absolutely crucial.
So thinking about how people engage,
Yeah.
where are they actually getting their science and health information from?
Well, the sources suggest that for most people, general news outlets play a really big role. A 2017 study found over half of Americans regularly get science info from general news.
Not necessarily specialized sources.
Far fewer actively seek out, say, science magazines or visit science centers or museums specifically for information.
That's significant, relying on general news.
It is, because general news outlets might not have specialized science reporters, right? And they often prioritize novelty, maybe the breakthrough, over explaining the actual process or context.
Right, the nuance might get lost. What about social media?
Social media definitely plays a role, but it seems to be more of a passive source. People encounter science news scrolling through their feeds rather than actively searching for it there.
Okay, so it just kind of floats by.
Yeah. And it's interesting, while most Americans say they've looked for science or health info recently, self-reported interest in specific scientific discoveries can sometimes seem lower.
A bit of a disconnect.
Possibly. It might be about how science news is framed. Often, like we said, it's just the findings, study shows X without much on the how or why. The inquiry process gets left out.
And if you don't get the backstory, the journey, maybe the finding itself feels less relevant or less engaging.
That could definitely be part of it. And then when you look at active participation in science,
Like citizen science or research studies?
yeah, those things are relatively uncommon for most adults. Helping a kid with a science project is more frequent.
Sure.
Visiting informal venues like parks or zoos is also quite common. But visits to specific science or natural history museums are a bit lower. And again, participation often varies by income and education.
So it seems like we're mostly getting science info passively via general media, and active engagement is less common and often linked to socioeconomic factors.
That seems to be the picture, yeah.
And this whole landscape, this whole challenge is made even more complicated by misinformation.
Oh, absolutely. The infodemic, especially during COVID, misinformation, disinformation, it just muddies the waters terribly.
Yeah.
It can lead to really poor health choices. It erodes trust in science and public health, and it definitely increases polarization, serious consequences.
We absolutely saw that play out. So what can be done? What strategies are there to counter this?
Well, it's a multi-pronged approach, really. One key strategy is just amplifying good, factual information, getting credible, accessible stuff out there widely. Initiatives like Dear Pandemic did great work there.
Right. Push out the good stuff.
Then there's active debunking, tackling specific false claims. Resources like the #Coronavirus Facts Alliance, Snopes, Retraction Watch, they play a role here. Tracking misinformation trends is also important, like the WHO does.
Okay, so reacting to the bad stuff and promoting the good, are there more proactive approaches?
Yes, and that's increasingly where the focus is shifting. Enhancing information literacy itself, teaching critical thinking skills so you can evaluate sources and claims better.
Empowering the individual.
Exactly. And related to that is pre-bunking or inoculation.
Inoculation, like a vaccine against misinformation.
Kind of. The idea is to proactively teach people about common manipulation techniques and logical fallacies before they encounter them. So when they see that tactic used later, they recognize it.
Ah, I see, like showing people how the trick works.
Precisely. The Go Viral game is a great example. It teaches you how to create viral misinformation, which actually makes you better at spotting it.
That's clever. Understand the strategy to defend against it.
Exactly. Other strategies include leveraging trusted messengers, community leaders, faith leaders to share accurate info, and even in conversations, using structured approaches like fact warning, fallacy, fact can help. The U.S. Surgeon General has put out recommendations for everyone, really educators, platforms, individuals on tackling health misinformation. It shows it's a complex problem needing action from all sides.
It definitely sounds like it requires a sustained, multi-level effort. That shift towards pre-bunking seems particularly promising, though. More sustainable than just chasing down every false claim.
Agreed. It's about building resilience in the long run.
Well, this has been a really, really insightful deep dive. We've covered a lot about the state of biomedical science literacy here in the U.S., some bright spots, but also some pretty significant challenges and gaps.
Yeah, it's definitely a complex landscape.
And it feels so clear that being informed on this topic is just vital for all of us, right? For our own health decisions and just for understanding the world around us.
Absolutely. It touches everything from personal health choices to how we engage with public health policy, scientific advancements. It's fundamental.
So thinking about everything we've discussed, the gaps, the disparities, the challenge of misinformation, what's one thing perhaps that you, listening, could consider? Maybe one step that might be effective in boosting this kind of literacy, even just in your own community or circle. It's definitely something to mull over.
Yeah, that's a great question to leave people with. And I just add, stay curious. Keep asking questions about the health and science information you come across. Look at different reliable sources. Talk about it thoughtfully. That's how we all build understanding.
Great advice. Thanks so much for joining us for this deep dive today. We really hope it's given you a valuable shortcut to being better informed on this really critical topic.